involved in the healthcare industry since 1982. That's quite a while, wouldn't you say? I've really looked at all different areas of healthcare and been around the block a few times. I did take a little sabbatical to raise children on the farm, but as they started to grow up and grow away, it was important for me to kind of find out what part of the healthcare industry I wanted to be in. I turned over a lot of stones and just happened to be at a conference in 2008 in Dallas, Texas, where I met a very famous football player and a woman who told me that when she was 40 years old, she'd been in a car accident and suffered a traumatic brain injury. Because of the myofascial tears to her face, she had no control over this side of her face and this eye. And then 2 months later, she had a stroke. She said this would make people uncomfortable enough, but then after the stroke, she couldn't talk so that you could understand her. My nursing assessments, I was thinking, okay, I'm doing my stroke assessment, all kinds of different assessments, and I couldn't find anything wrong with her. So I said, either she's lying, or maybe she's telling the truth, but her story wouldn't leave me. So I started turning over the stones. I took a year doing research, reading studies, and also seeing the treatments and the efficacy and the results for myself and many, many patients. In 2009, I decided to found the company and realized to get the results that she was talking about, it was important that people follow a very strict protocol. So the audience that I'm talking to directly are those who are healthcare providers, those who are entrepreneurs, those who are in the business industry, maybe you own your own business, and those who are maybe in the senior care living facility. Because I know you got involved in these different areas because you really care about people. You wanted to make a difference in the world. So, with starting the Pain, Injury, and Brain Centers of America, we were on a mission to keep protocols, to keep treatments pure, and be an asset to those people we come in contact with. This is a partial list of what we treat. And like I said, this is a partial list. Once you understand how things work scientifically, then it's easy to understand why we make the claims that we do. So that's a pretty extensive list. And like I said, that's a partial list of what it is we treat. For proper implementation of the protocols that we use, we're able to increase the body's own ability to heal by 500%. It's non-drug, it's non-invasive, it's virtually pain-free. The original equipment was founded by your same scientific team that developed your EEG, your EKG, your EMG, and your lie detector. This was originally registered with the FDA in 1983. And through proper implementation of those protocols, we have an over 95% success rate. The history of the equipment. Well, like I said, it was developed in the mid-1970s by the same scientists that developed those great inventions. And they said, you know, we're diagnosing electrically. We should be able to treat the body electrically. I thought that was pretty smart. So they met with the federal government, and they found out that if they implemented some of the missile guidance technology, search out and find principles, that they could search out and find out weaknesses in the body electrically. These are Class 2 medical devices, and through proper implementation, we use licensed healthcare professionals, nurses, physical therapists, doctors, chiropractors, many people in the healthcare industry to provide these treatments. But they originally developed for an elite group of people, your professional athletes. They didn't make it widely available to the public, and they still don't. So that's where we saw a need to bring this technology. Thank goodness for our healthcare practitioners. They have so many tools at their disposal, and they have a desire to help people. However, for one reason or another, they have a patient that doesn't respond to treatments like they should. And that's extremely frustrating when you want so much to make a difference. That's why we got into this field. So, in case you're wondering who this picture is, this is Scott Baker, and he is a pitcher for the Minnesota Twins, at least he was. And he did a great thing. In 2010, we treated him, and he had an elbow injury, and came to us. After 5 treatments, he became the #1 pitcher for the Twins that season. We have lots of stories like that, and if you come to one of our Discovery Days, then you'll hear a lot more stories. But scientifically, how does this work? Well, we're treating the body from a physics standpoint. We are electrical beings and run on electricity. You know, they say at night we recharge our batteries. That's what we do. But also we need to produce electricity in the body. Our electricity is produced by the foods that we eat, and some, especially the pigments in our fruits and vegetables, are high in electricity producing materials. Our bodies are nothing more than an electrical power plant. If you went to an electrical power plant, you need a good quality source to manufacture electricity. Well, same thing with the body. We need a good quality source. You would never put sugar in your gas tank of your car and expect it to run efficiently. Well, we think we can put all this junk in our body and expect it to produce great results. Well, we live by grace in these bodies, and at some point we have to pay the piper. You either pay him now or you pay him later. So when patients come to us, we say, are you manufacturing enough electricity? We take readings and see. On your cell membranes, they're semi-permeable, and you get some exchange because they're a semi-permeable membrane. But also on the cell membrane are 24 to 48 little voltage-sensitive gates that open and close letting nutrients and waste product out. And those areas that are registering lower than normal healthy tissue, you don't have that exchange. Those gates don't open and close properly, facilitating that cellular respiration. So you have an area that breaks down, an area that fills with cellular acidosis. What this equipment does is it scans the tissue, and normal healthy tissue resonates at a certain frequency. Anything that's impaired, injured, or diseased registers at a lower frequency. So the equipment's going along and it's looking for that drop. Even though you might have pain in your feet, that disruption in the electrical system might be further up, and we feel like we're cheating because the equipment tells us exactly where the problem is. When it finds that area, it sends out artificial intelligence and a signal that's especially to that patient. So it's impossible to underdose or overdose. The equipment calibrates between a millionth and a trillionth of an ampere, so it just takes a very small amount of electricity. So with that, people ask, is this like a TENS unit? Well, a TENS unit, we say, is kind of like an abusive relationship, someone who slaps you up. Take as much as you can until you can't stand it anymore. And it calibrates at 1,000th of an ampere, much too large of a current, to increase ATP production or your ability to heal. This is much gentler. We say it's like a healthy relationship where somebody romances you and takes good care of you. So it takes a very small electricity, like I said, to bring that up to a normal, healthy resonance. When that happens, the cellular acidosis that's accumulated in an infective area is dispersed. And then you start to establish that normal cellular respiration. That happens in the very first treatment. Most of our patients start to see results in that very first treatment, and then it just builds from there. A lot of patients, when they get off the treatment table that very first time, say, wow, I can't believe I feel better already. They still need to come, and you still need to heal those cells and train them to be healthy. Let's see. The equipment does calibrate at a millionth to a trillionth of an ampere. We like to work with local healthcare practitioners, whether they be doctors, chiropractors, nurses. Nurses are great in this industry to help run one of our franchises. But like we said, these are great for patients who don't respond to traditional treatments like you normally would. However, those treatments build a great foundation for us to build on. We're a specialty treatment that is not widely available to the public. We are educators. We participate in many local events, and we sponsor many local events because we have to get the word out. People need to know this is available. When we discovered that this has been available since the 1970s, it kind of ticked us off, because who says that professional athletes are more important than you and I are? Let's see what else. I mostly like to talk about the patients that we treat, the results that we get, and the difference we're able to make in people's lives. And it's hard for me to talk about the revenue side, but I will tell you, this is a very nice second stream of revenue, or a first stream of revenue, for those entrepreneurs who want to get in and do this with us. Another, besides healthcare practitioners that we work with and like to partner with, we also like to work with businesses. Wow, since I started my own business, I really have a heartfelt need to talk with business owners, because really as a business owner, you put everything on the line to produce a successful business. And I think, when I was an employee once upon a time, I just didn't realize the sacrifice that business owners make to build a business and to do something productive. And they're always worried about the bottom line. They're the last ones that get paid. But when I realized that one workman's comp claim can destroy a company's profits for a whole year, I said, wow, we need to help them. Because what we do is affordable. We like to partner with businesses and go right into the workplace, because businesses have the best chance to influence for good the health of several individuals and their family members. Businesses are the best place to have successful healthcare outcomes. Businesses who have on-site clinics can save hundreds of thousands of dollars in healthcare costs every year. Some price comparisons are, if you have a simple carpal tunnel, it costs between $25,000 and $35,000 to have surgery and physical therapy with no promise of how much downtime there's going to be. If we go into the workplace or somebody comes to one of our clinics and they're treated Monday through Friday for 2 weeks, the cost is between $800 and $1,200. There's no downtime, there are no side effects, and patients become more productive after the very first treatment, so the side effects are minimized. Neck, Crohn's disease, back injuries, headaches, knee injuries, degeneration, arthritis, a whole host of healthcare ailments. We can really reduce the healthcare cost with that. By the time people come to us, they've already spent tens of thousands of dollars. So we hope that practitioners can feel better about what they're doing as far as satisfaction and really getting some great results after they've tried everything, and our patients are so much happier. Some other things that's important for you to know is PIBCOA has a threefold mission. Number one, we want to make sure that everyone has access to this therapy and not just a select few because of who they are. Our mission is to help practitioners have one more tool in their toolbox to help their patients. Number three, our mission is for employees who bust their backside every day giving everything they can to their employers, but also for those employers who put everything on the line financially to risk everything they have for a dream to build a successful business, to help people have jobs and contribute to the economy, that they have something to give back and invest. Also, what we're doing is we're putting together something called the PIBCOA Global Foundation, where much has been given to us, much is expected, I believe. And we're currently pulling people together, other business owners, and we plan to start doing medical missions by the end of 2017. And we're really excited about that. And if you have questions, please contact your broker. We're really looking forward to meeting you.